Hello, everyone, and welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine and Dr. Serge Gauthier, Professor Emeritus, formerly of the McGill University Research Center for Studies in Aging. These webcasts are made possible thanks to the generosity of donors. Today's topic is a natural history of aging and Alzheimer's. And I'm very excited to have Jay Ingram as my guest here today. Jay is a science broadcaster and writer. He has hosted 2 national science programs, Quirks and Quarks on CBC Radio and Daily Planet on Discovery Channel Canada, and has written 19 books, 3 of which have won Canadian Science Writers Awards. Mr. Ingram has 6 honorary degrees and is a member of the Order of Canada. From 2005 to 2015, he chaired the Science Communications Program at the Banff Centre. He is currently one of the hosts of the podcast Anthropomania. His book, The End of Memory, A Natural History of Aging and Alzheimer's, was published in 2014. Welcome to McGill Cares.
Thank you, Claire, and good job on pronouncing Anthropomania. It makes most people stumble at least once.
Thank you. So I think just to begin, before we're going into the history of Alzheimer's, really, I'd like to start by asking you, what motivated you to choose this field? Do you have a personal connection with the illness?
Yeah, I have more than one personal connection, but I hope it isn't disappointing to say I'm not really sure that was the key motivator for me to write a book about Alzheimer's. My mother had it, or dementia. It was never properly diagnosed. Had an aunt, had more than one aunt, father-in-law, mother-in-law. So, there are people strewn around my family history that unfortunately had dementia. On the other hand, I am a science person, and the intricacies and challenges of the science were fascinating to me. And you know what? In the end, I just thought people should know more about this, not just about the difficulties in dealing with it, whether you have it or whether you're a caregiver, but just if you're an observer, it becomes more likely that you'll encounter it as you get older, no matter who you are, whether it's not you, it's somebody else, whether it's you. And I just think having some understanding of it is a better thing than not having that understanding.
So can you give us a bit about a history? Where does it come from? Has dementia always existed? And, where did the name come from?
So I don't think anyone doubts that dementia has always existed. There are descriptions from centuries ago, even going back millennia, that would suggest that people were encountering mental health issues that look a lot to us today like dementia. But it appears relatively infrequently compared to today in past centuries, for the simple reason that people didn't live to the susceptible ages, say 65, 75, 85, because they were killed by infectious disease, heart disease, a variety of cancers for which there was no treatment. And if you saw a graph of the number of 100-year-olds living in the world today, this is one graph that goes flat for centuries and then is almost vertical now. So many, many more people are escaping the things that killed us earlier today, living into older age where degenerative neurological conditions, Parkinson's, dementia, ALS, and so on, are the things that await us. So it's been around forever. It's named after Alois Alzheimer, a German. Well, he was interesting because he was both a really great microscopist, and so he could study brain tissue more skillfully than most. But he was also a clinician, and so he saw patients. And he saw a patient in the early 20th century, starting in 1905, who came to him at the age of 51. She clearly had dementia already, and he counseled her and saw her for the next 5 years until she died. But then he prepared microscope slides from her brain tissue, identified oddities in them that he called plaques and tangles, deposits in the brain that shouldn't have been there. And hence we have the name. And that brings us to today. We've been looking at what we now call Alzheimer's for 115 years since Alzheimer published his results. And that's where we are.
So in your book, you were talking about, many, many, many like centuries ago when people had Alzheimer's or were shown demented, it was really, there was a lot of stigma around it. Like it was as if they were being punished in some way. And I look at today, there's still a lot of stigma around this illness. Could you talk a bit about how people were viewed back then? And I mean, because it still seems like there's there's still that whole thing. People don't want to talk about it. They want to hide the illness.
Well, it's kind of ironic, isn't it? Because if you looked, say, there was and there wasn't stigma. So when I was a kid, people wouldn't really talk about it, but they would just say, "Oh, Aunt Becky is gone dotty," or some such meaningless phrase, just meaning that her memory had gone and she was having trouble communicating and so on. But it was considered that there was no point in even going to a doctor. What's a doctor going to do? This is part of aging. This is what happens to us when we get older. And I think we've made a major step forward by asserting that, no, this is not natural aging. There are lots of people that don't get dementia. And there's, an unfortunate group that does, and we have to distinguish between the two. I think today, the stigma mostly comes from the fact that people who are unused to dealing with people who are living with dementia don't know how to do it, and it makes them feel awkward. I've seen this in my own kids as they struggled to deal with their both grandmothers and other relatives, that at first you don't really know how best to communicate when somebody is less communicative than they used to be. And I've boiled it all down to, if you know somebody or you're going to visit somebody in a long-term care home who's living with dementia, the goal of the visit is not to correct misapprehensions that they have or thoughts that they have that don't make sense to you. That's not the goal. The goal is to leave them hopefully happier than they were when you first arrived, and forget all any other sort of details. The goal is to comfort them, make them happy, make them feel at ease, and do your best to communicate.
When you mentioned before about how people just thought it was, normal aging of progressive, I think one of the biggest challenges, and I wonder if you'll agree, is that the majority of the people do not know what the early signs and symptoms are. Like I was very happy to see that you were one of the spokespeople for the Public Health Agency of Canada. They're the Canadian Dementia Community Investment Fund. There's a strategy, but there hasn't been enough public awareness campaigns about dementia. People just don't know the signs. People automatically think, if you have issues with memory, that's dementia. But people don't also realize it could be a significant change in personality, behavior. Do you see that as well?
Yes, and the changes in personality are even more challenging than loss of memory, because, for example, if a loved one suddenly becomes a little more aggressive than they were before they were living with dementia, that's very, very hard to deal with. Very few of us have learned the skills of how to deal with that. And it's even wider, because I keep referring to seeing someone in a long-term care home or a loved one. But in fact, what happens when you encounter somebody living with dementia in, say, the supermarket? Do you know how to deal with them? The Public Health Association had a really nice little short video about people at the checkout, in a supermarket, and three people and one sort of intervened in a proper way. But these are things that we really don't innately or naturally know to do. And, given the numbers, I think this is something that we all should acquire. The ability, the knowledge to have a comfortable interaction with somebody who's living with dementia and may not be, quite sort of reacting to you in the way that you expect. I think that's the key.
So to quote from your book, Alzheimer's now dominates the discussion about aging as no other disease has done. A short while ago, this wasn't the case. Heart disease, stroke, and cancer were considered to be the principal hazards of or threats to a long life. Now, when nearly 1 of every 2 people over 85 is demented, Alzheimer's casts a cold light on the prospects of living long. So that just really stood out to me, that 1 out of every 2 people over 85 is demented. So would you say that the increase in human life expectancy, the fact that people are living longer, is really contributing to an increase in the number of cases?
Yeah, for sure. I think that's a major factor. If an individual has dementia when they're 85, but otherwise they would have maybe died of heart disease at 68, then, you never would have known. So I think it's absolutely crucial. But having said that, I mentioned the number of 100-year-olds living today, and many of those people do not have dementia. So it's not inevitable. And, maybe we'll have an opportunity in the next few minutes to talk about some of the things that you can do but, I'll give you an example. My mother had dementia, lived to 94. My dad was her real caregiver. He was 2 years older than her at the time. And it just struck me as being, this is really not the way you want to end your life, going to a nursing home or a long-term care home every day and looking for some tiny spark of awareness in the person that you've been married to for 70 years. My dad lived to 98. He didn't have dementia. His short-term memory was kind of shot, but that didn't matter really. You just remind him, but his mind was working fine. So, I have both examples in my family. It'd be very hard for me to identify what determined that one had dementia and the other didn't. Maybe genetics in my mother's case, because her sisters did too. Maybe my dad was lucky genetically. But, yes, it's more common with age for sure. But, that's just something we have to not only recognize, but try and do something about.
So before we get into the whole, what people could do to hopefully all the protective factors, can you talk to us about the Nun Study and its fascinating findings that you wrote about in your book?
Yeah, the Nun Study, it's kind of paradoxical. It's fascinating, as you suggest. But in a way, for people reading it, long after they left school or, in middle age, it can be a little bit challenging. So here's the story. There was a school of the School Sisters of Notre Dame convent in the U.S. It had many places where it existed, but they were recruited probably about 15 years ago now to participate in a long-term study. And the experimenters asked the nuns to take a yearly psychological test, or maybe every 6 months, and also submit their brains for study after they died. One of the most fascinating things about it was they also had access to short essays that young women, women in their late teens, wrote when they wanted to join the convent. And so these were written, as I say, when they were 18, 19, and they were then able to identify who wrote those and now study them when they were in their 80s and even 90s. And it turned out that the risk of dementia at that age correlated to the way they wrote their essays when they were in their late teens. And the essays that were less dense with ideas, that were more kind of superficial and not as deeply thoughtful, increased the risk for dementia later in life. There were exceptions. Sister Mary, famous one, I think she was 101 or 102 when she died, and was doing better in the psychological tests than her much younger colleagues, who of course were like 82 or 83. And, she didn't get her high school diploma until she was 39. So it's a little bit puzzling, but here's what I think the lesson is that comes out. And this has been supported by many, many studies after the Nun Study, which is something crucial happens in early life. Let's say the first 20 to 25 years of your life. It seems these days to boil down to, how long did you stay in school? Mm-hmm. Whatever it is, whether you were in the Nun case, a kind of expressive writer, who knows why, whether today it's, did you go to university or college or not? This correlates very strongly with your resistance to developing dementia. And it kind of boils down to the further you go in school, the lower your risk. And it's a significant piece of your overall risk. It's a little bit, it can be upsetting to tell this to people who are, let's say, in middle age and did leave school early, because the evidence that you can catch up or replace the loss of that early education by, saying, doing Wordle every day or Sudoku when you're on a plane or anything, that evidence is suggestive that it helps, but it doesn't seem, as far as what I've been able to see, to replace just that issue of staying in school. And I wonder if it isn't something like when you're in school, you don't get, like, you have to learn. Right? You're not, it's not optional. You don't decide, okay, I'm going to read a little math after dinner. It isn't like that. And whatever it is, it seems that early schooling establishes something that researchers like to call brain reserve. Nobody knows exactly what stuff in your brain that is, but it does seem to protect you, not forever maybe, but to protect you against developing dementia.
When I was reading that chapter, what started to come to my mind in today's society is how, even I look at, my kids, for example, how often are they sitting down with a pen and paper and writing and really taking the time to read? I mean, I have one daughter that loves to read all the time, but the other daughter, unless it's for school, she won't read. And we're so attached to our phones. We're spending time watching Netflix. Like, our brains are not being stimulated the way they used to be. And the days of really sitting down and enjoying a good book and absorbing, it's all now our iPads, and that has to have an impact at some point as well. Do you think?
Yeah, we won't know for quite a while. And maybe, I mean, so, in a way, I would generalize what you just said as being active versus passive. And, but, if we're talking about late teens, early to mid 20s, right now, well, it's going to be 40 to 50 years from now. And they may just be lucky in that I'm pretty confident in that time span, and probably much sooner, we will have some effective medications. So, but I don't doubt that you might be right. It's just that, unfortunately, I'm not going to be around to see if you are or not.
So now the important questions, because your book is called The End of Alzheimer's. And why don't you share with us what as a scientist, what are some of the protective factors to hopefully avoid dementia and Alzheimer's disease? Like what can you tell us?
I just want to, you said the end of Alzheimer's, and I'm not predicting that.
Oh, sorry, the end of memory. The end of memory, sorry. The end of memory. I'm trying focused on it. Wish we could end Alzheimer's.
You know what? It's just a title.
Yeah.
But risk factors. So this has come into, it's become preeminent in the last maybe 5 years. The Lancet, the famous English medical journal, has struck a variety of commissions, groups of people to assess what the situation with respect to various medical conditions is. So in 2017, and then again in 2020, they released their estimates of the list of risk factors that increase your risk of Alzheimer's or probably dementia generally, because there are several kinds and even mixed kinds. But so early education is really important, as I've already said. Genetics is important, but you know what? Anyway, you're stuck with your genes. Okay. So the thing about genetics is that with the exception of a very small number of inherited early onset cases of Alzheimer's, which amount to, familial early onset amount to 1% or so of all the cases, you do inherit a gene that will give you Alzheimer's. So in families where that gene exists, and, usually, unfortunately, people have children before they know they have the gene because they don't have any symptoms when they have children. There are difficult decisions that have to be made by the children. Do they get tested? Do they not get tested? But that, and I just really want to emphasize this again, because sometimes people miss this point. It's 1%-ish of all Alzheimer's. The genetic risks for late onset, non-familial Alzheimer's, the kind of Alzheimer's that most of us would worry about, are not prescriptive. Like if you inherit, for instance, my mother had dementia. What if I inherited a gene that adds to my risk? And maybe I inherited a similar gene from my dad, even though he didn't display it. So I've got two bad genes. Well, it raises my risk, but it doesn't, it's not a sentence, It doesn't say, yes, you're going to get it. What it says is your risk is raised, but there are many people with two bad genes, like I just said, who sail through life without any dementia at all. So it's a risk enhancer. But what can you do? What can you monitor to kind of eat away at that increased risk? Hearing loss, the Lancet Commission says, especially recently, is really a significant risk. I wear hearing aids. I have hearing loss. Obviously, that's an interesting risk for me to contemplate. But it looks like, and the results in this are still pretty early, that wearing hearing aids, as I do, mitigates that risk. So, I would say to anybody watching this, if you think you have even a mild degree of hearing loss, please go see an audiologist, get an assessment, and see if hearing aids are for you. There's other things you can do, but it's super important. And, this is still an area of early exploration, but it looks like loss of social activity, social contact is probably what's going on there. Interestingly, I've heard from people in the business that the next Lancet Commission will also identify things like cataract. So reduction of vision, reduction of hearing, in general, reduction of sensory input is going to, if it isn't already seen as important, and I think within the research community it will soon be clear to all of us that these factors, anything that cuts down the information coming into you from others, from outside, might predispose you. Then there's a number of medical conditions, high blood pressure. If you've got high blood pressure, monitor it. Diabetes, you can treat it. You can't really eliminate it at this point, but treat it as best you can. Weight, keep your weight down, eat properly, exercise, maintain social contact. All of these things that we kind of already know are important for a good life, each contribute 1% to 2% of heightened risk if you don't engage in any of those things. So, for many of those, there is an Alzheimer's diet, but there's also the Mediterranean diet, which I think many people have heard of. And, basically you could call it the sensible diet. Don't eat a huge amount of fatty red meat and a ton of sugar and any of that. Just so I think a lot of those other recommendations beyond hearing and like social contact, those kinds of things, they're pretty sensible things, I think.
Is there also any correlation between like where you live, versus like, because I believe you wrote a chapter on that as well.
Well, interestingly, since I wrote the book, because that book is now 6 or 7 years old, air pollution is a significant contributor. So, traditionally, and this has been known for years and years, when I was hosting Quirks and Quarks in the 80s, we were talking about these kinds of things, that if you look at the way cities and towns in North America have been set up, if the prevailing wind comes from the west, you can bet that the eastern parts of town are poorer because they're getting all the pollution generated upwind dumped on them. Air pollution, there was a great study that showed even an increased distance of, say, 400 meters from a highway increased your risk of dementia. So that's one thing. And, there are, if you want to think of ideal places to live, there are something like 5 areas that have been called blue zones.
Yes, I was going to ask you about that. Yeah. So what differentiates the blue zones from?
Well, the cookbook that somebody gave me would argue that it's what they eat. So, primarily vegetarian. I won't go into all the details. I mean, you can get, I'm not necessarily recommending it, but there is a blue zone cookbook. So possibly it's somewhat genetic. Probably it's a combination of diet, probably physical activity. There's a huge difference between living where I do in Calgary, and if I want to go downtown, I jump in my car and I get like a minimum of exercise if I choose to do it that way. So there are circumstances where people have worked hard all their lives and continue to work hard. And if the work doesn't kill them, it looks like neither will dementia. So, but the thing that's a little bit awkward about this is that you don't really want to tell people who aren't living in the right kind of place or who left school early that these are big risk enhancers that, unless they actually pick up and move, they're not going to be able to treat. So I would prefer to put emphasis on the, staying fit, keeping your social life active, and those kinds of things that you actually can do something about, no matter how old you are.
So one last question for you is, as a scientist, like how far are we away from actually finding the cure? Like, why is it so difficult to find that magic pill that will cure Alzheimer's?
Yeah, it's a mysterious condition. I mentioned earlier that Alois Alzheimer identified oddities in brain called plaques and tangles, and those are still the targets of proposed medications these days, but they have not done well in clinical trials over the last 10 to 15 years. And I mean, the cruel irony of some of that is that these medications that aim to reduce the number of plaques in the brain actually do reduce the number of plaques, but for some reason, the dementia decline continues unaffected virtually. So that just increases the halo of mystery around them. Okay, these plaques seem to be there in most, at least Alzheimer's patients' brains after death. But, what are our medications trying to interrupt them too late in the process? Maybe they're just the sort of detritus left in the brain after the disease process has taken hold and done what it's going to do. So here's what I would say is helpful or hopeful. There is a drug that's been okayed by the Food and Drug Administration in the US, but its effects are minimal. I mean, Many Alzheimer's researchers were dismayed when this drug called Aduhelm was okayed by the FDA, because they're pretty convinced, like the positive evidence that came out of clinical trials was very slender. And so they're worried that people will jump on this drug. Of course they will. It's very expensive and it may not work for most people. However, it does have some effects. And so you have to sort of say, okay, we're at that point in the development of effective drugs. We seem to be getting to a place where maybe there will be an impact. Money is an issue, right? You've got to pour a lot of money into research, and it's much better than it was, say, 5 years ago. Heart disease and cancer are still probably the most important in terms of funding, but Alzheimer's has crept up and is, I would say probably grouped within those other two as the big three. Do we really I'm not a scientist, but, do scientists really understand what's going on? I think there's much to learn still, but I would say, it's 2022. I would say, in 5 years, I think we'll be much closer, if not in possession already, of some medications that work. One of the quick issues, I don't want to go on too long about this,
that's
but
fine.
one of the issues is, and I alluded to it briefly, is, are we giving these meds soon enough? Because if you look at a graph of when the plaques and tangles build up in the brain versus when symptoms first appear, they've been building up for a long time before the symptoms become evident. So should we not be maybe trying some of these drugs earlier, like before symptoms? But that, of course, raises the ethical issue, which is, if you don't have symptoms, is it really justifiable taking a drug that may have side effects? So that's why a major component of research these days is to develop and understand markers in the blood or in the brain that can be detected by brain imaging or a blood test or whatever, that will say with a strong degree of certainty that Alzheimer's has started, even though the person may not even be showing, what is often the earlier stage, mild cognitive impairment, even before that. So there may be a kind of two-step thing going on here. Get really, really solid tracers so you know exactly what's happening before it appears to happen in terms of symptoms, and then have drugs that you can start giving people who qualify with that. There's an interesting study going on in Colombia right now, and I don't think anything definitive has come out of it yet, but there's a very large group of people who have the gene that does give you early onset Alzheimer's. And so they've, at ages like late 20s, they're being given medications to see if they can prevent that. I hate to say this for people who are kind of, set to develop Alzheimer's, they're a perfect group because it's known they will get it. So at least a good part of the ethical issue is kind of washed away by that. They're going to get it. They'll probably show symptoms in their 40s because it's really early onset. Let's give them drugs in their late 20s. So, in the next couple of years, hopefully some definitive results will come out of that, and we'll be in a better place.
And then we'll have to really educate the public about where to go and get these tests done, right? I mean, it's to, even if we have the ability to test. I mean, I remember when my mother was showing signs and symptoms, I didn't even know what type of doctor to take her to see, right? Was I supposed to take her to see a psychologist, or was it a family doctor, or what type? So even just to give people access to be able to go and have these type of tests and assessments will be the next step. Right?
That's right. Well, and that's why it's so challenging. And I would just say about this Columbia experiment, those are people who have inherited a gene that confers early onset. Is that the same as my mother, who starts to show symptoms when she's in her late 80s? It may not be. I think there's a lot of faith that, yeah, it's the same, just on an accelerated path. But what you say about not knowing where to go just illustrates how complex this is, because we talked earlier about stigma. People don't know much about it, which is why I wrote my book. But, I'm fully aware that not that many people would read it and suddenly feel more competent to take it on. So you've got stigma, you've got caregivers who are being burned out, whether they're professional caregivers or family. The family often don't have the skills that professional caregivers have. So there's a lot going on. And I think the public health agencies campaign in January and February to alert people to the problem that stigma alone provides. We didn't talk at all about treatment or drugs or anything. It just shows that this is a multi-component issue that is going to be tough to deal with. But if we don't deal with it properly, the numbers are just going to continue to rise.
No, and until we find a cure, I think the most important part of it all is education, just becoming as educated as possible on this illness. And Jay, I'd like to thank you so much for being with us today. Your book is called The End of Memory. I know that we also have a slide up on the screen, and people could get a copy via Amazon, I believe.
Yep, I think so. I'm sure. Yeah.
Well, thank you so much for taking the time to be on McGill Cares today.
Well, thank you, Claire. It's been a pleasure.
This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program or for more information, please visit us at mcgill.ca/dementia. And if you would like to join our mailing list to be notified about upcoming episodes of McGill Cares, as well as other important programs and resources that we offer, please email us at dementia@mcgill.ca. Thank you for watching.